Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. So, getting off from work again tonight. Basically, it's at the cusp of another day, so it's about, I think it's 12 a.m. Sometimes I get out of here later than I anticipate. I had to declare a death. That's part of my job as a hospitalist, PA. Somebody asked me about hospitalist medicine and what it is a hospitalist does. And it's kind of interesting because it's markedly different from what I used to do, which was outpatient medicine at a small clinic. So hospitalist medicine, it's a relatively new field, if you will. Maybe I would call it a new term, but it's if you can imagine, many patients, or everybody just about now, has got their own primary care provider, whether that primary care provider is an MD, a DO, or a doctor of nurse practitioner. But with the advent of more Americans having insurance, more people are being treated at hospitals a little bit longer for certain things. For instance, if you get into a car accident, or you have a heart attack, or a stroke, or I don't know, some kind of upper respiratory infection that requires hospitalization, you may find yourself in the hospital for, if not a few days, sometimes a few weeks. So, in this, maybe several weeks. In this instance, your primary care physician or provider, your primary care clinician, will not be the one rendering your care. There needs to be one contact person who's going to be rendering your care, and your care may involve several teams. Maybe a nutritionist. If you happen to have an infection, there'll be an infectious disease specialist. Maybe a physical therapist. If you've been in a car accident, then there's a number of people involved in your care. So what the hospitalist does is they really kind of orchestrate your care among the interdisciplinary teams. So it's the hospitalist's responsibility to communicate with the different teams and make sure the hospitalized patient, is getting what he or she needs to get better. And often what they'll do is they will communicate with the primary care provider. In certain instances, they'll also communicate with other specialists who are outside of the hospital. So for instance, if I have a patient who is status post-CVA, so they've had a cardiovascular accident, and they have, it's a stroke, otherwise known as a stroke, or they've had some kind of subdural hematoma, or a burst blood vessel, and they need something called a craniectomy. So the neurosurgeons are going to remove part of the skull. I would call the neurosurgeon if that patient needed to be sent out to have what's called a skull flap repair. And depending on the insurance, somebody would arrange for that patient to go out, and then they might even come back to our hospital for further wound care or something like that, or physical therapy if they needed that. But it's an interesting job. The thing I like about being a hospitalist is that you have to be kind of a generalist, so you're almost like a jack of all trades, as it were, master of none. So I've got to be savvy enough in other aspects of medicine to know when it's appropriate to make a referral. So when do I need to get a consult for a cardiologist or a nephrologist or the urologist or the infectious disease specialist. And I've got to communicate these things to my supervising physician. And it requires a lot of teamwork. So that's another thing that I enjoy about it. I really like being part of a team. Hospitalist pay tends to vary for physician assistants. I think in D.C., Washington, D.C. anyway, the average is about $113,000 per year. That does not always include bonuses that you may be privy to, depending on the hospitalist group for whom you work and where you work. For physicians, it tends to run about $280, just doing a brief internet search. And things are always going to vary. You may go to one internet search, it'll vary. But if you really enjoy general medicine, if you enjoy working on a team, if you enjoy being in a hospital, ordering and interpreting labs and things like blood work, different tests, and you may find a knack in hospitalist medicine. I personally don't like things like OR. I eschew pediatric medicine. Not too crazy about psych. So hospitalist for me is a good fit. And coming from my background in small clinics for internal medicine, I think I've got a pretty good understanding of the various aspects of internal medicine, which is something that you need. So if you want to be a hospitalist PA, while you're in PA school, my suggestion would be to really know your anatomy and physiology very well, have a very, very good understanding of clinical chemistry, the various labs that you need to order, because you're going to be expected to, like if you have patients that are hypokalemic or hyperkalemic, electrolyte imbalances, how do you correct for those? Number one, you need to understand the pathophysiology of why that might occur. So I think there's Robin's basis of pathophysiology is still the Bible, quote unquote, of pathophysiology. So know that very well. Have a very good understanding of pharmacology, even though you got to be working with some pharmacists. We have some very outstanding pharmacists where I work. So we're in constant contact with each other. But that's what hospitalist medicine entails. So if you're interested in becoming a hospitalist, please feel free to ask your questions in the comment section. I'm thinking about doing a live Instagram or a live Snapchat or something. I'm still trying to get internet savvy. I just joined Instagram, so I'll do a live Facebook or something. But let me know if you're even interested in listening to the talk live in the comment section. But I wish you all the best of success in your positive endeavors. Those of you guys that are pre-PA students or in the midst of your PA studies, keep up the great work. It's been great meeting a lot of you all on Instagram. It's really worth it. I mean, I love being a physician assistant. I started my PA sojourn back in 1997 at Howard University. So it's been a great 20 years thus far. And I hope you guys will enjoy this profession as well. Take care. Peace.